and study hypokalemia. What is hypokalemia? Hypokalemia is when blood potassium levels are too low. Potassium is an important factor for nerve and muscle cell functioning, especially for muscle cells in the heart. Your kidneys control your body's potassium levels, allowing them to excess potassium to leave the body through urine and sweat.
Okay. Okay. So the normal level of potassium in the human body that should be inside of your body is 3.6 to 5.2 millimoles per liter. So if the potassium in your body is not between these points, you should probably get a checkup and make sure that everything is okay. And second of all, if any of the any hypokalemia symptoms appear, which include weakness, fatigue, constipation. This is when I'm pretty sure you guys know it, but it's when you can't release feces, and muscle cramping and palpitation. Palpitation is when your heart starts beating really fast and uncontrollably. So if any of these symptoms occur, you should probably check up with your doctor to make sure that everything is okay and have further medications. Level hypokalemia. The word hypo means low. So this if the levels potassium gets lower than 3.6, which is the normal, then you should get a checkup. Anything below 2.5 millimoles in a liter is life-threatening low. So you should really check up on yourself. And at this level, which is 2.5 millimoles per liter, symptoms that may occur are paralysis. It's when you don't have control over your body. Respiratory failure, breakdown of muscle tissue. You begin to become real tired. Your muscles don't even start to work. And ileus, lazy bones. This is when your intestines don't work properly. In more severe cases, like even more than 2.5, the most common people who take digoxin have irregular heart rhythm conditions. So if your potassium is real low, you're going to have heart problems because potassium is a really important nutrient to the heart, and you begin to have fibrillation, tachycardia, which is when your heart beats too fast, bradycardia, which is when it's too slow, and premature heartbeat. And other symptoms include loss of appetite, nausea, and vomiting. Vomiting is a big thing when it comes to hypokalemia because you may lose most of your potassium through vomiting. So if you're vomiting a lot, maybe you should really get a checkup because it's really dangerous.
So, what causes hypokalemia? The causes of hypokalemia are these sicknesses and diseases, which includes Bartter syndrome, Gitelman syndrome, Lille syndrome, Cushing syndrome, eating substances like guanthonides or glycyrrhizin, potassium wasting diuretics such as Cyzides, loop, and osmotic diuretics, long-term laxatives. Mohammed, can you describe the laxatives?
Yeah, the laxatives are like when you are constipated. What happens is you use these things to make movement in your intestines and make sure that everything that you release your feces, and overuse of laxative or long-term use of laxative can cause hypokalemia. And by the way, all of these diseases and syndromes I think we were going to talk about like in detail about each syndrome. What happens is if you get these, there would be a condition where your body cannot use or does not function well with potassium. That's why you get hypokalemia.
And high doses of penicillin also causes hypokalemia. Diabetic ketoacidosis, and also more diseases, including delusion due to IV fluid administration, magnesium deficiency, adrenal gland issues, malnutrition, poor absorption, hypothyroidism, delirium tremens, renal tubular acidosis type 1 and 2, catecholamine surge, drugs, barium poisoning, familial hypokalemia. The risk factors of hypokalemia, including taking medications, especially diuretics known to cause potassium loss, have prolonged illness that causes vomiting or diarrhea, and have medical conditions like the ones listed on slide 7 and 6. Yes, diagnosis.
So your doctor, if your doctor will usually discover if you're at risk or have hypokalemia through blood and urine tests. So when you get a checkup or you have any, if you go to the doctor and get your blood or urine tested, that's when they could see what your blood or urine is composed of and see if the potassium levels are at where they should be. So yeah, basically these tests see what exactly is in your blood, like percentages, the nutrition's in them, everything, in order for them to check if you have any irregularities, which include hypokalemia.
So, someone who has hypokalemia needs hospitalization. They will also need heart monitoring. Treating low potassium levels in the hospital requires a multi-step approach. Remove causes. After identifying the underlying cause, your doctor will prescribe the appropriate treatment. For example, your doctor may prescribe medications to reduce diarrhea or vomiting, or change your medication. Restore potassium levels. You can take potassium supplements to restore low potassium levels, but fixing potassium levels too quickly can cause unwanted side effects. Monitor levels during hospital stay. At the hospital, a doctor or nurse will check your levels to make sure the potassium levels don't reverse and cause hypokalemia. Instead, high potassium levels can also cause serious complications. Prognosis.
So hypokalemia is treatable. As Jan said before, treatment includes treating the underlying condition, which is probably the other disease that you have that is causing hypokalemia. Most people learn to control their potassium levels through diets and supplements. There are special foods and supplements, let's say, that you should take in order for you to control the potassium level, which we will talk about later. And you should make appointments with the doctors if any symptoms of hypokalemia are showing, which we said before. The earlier the treatment and diagnosis will help prevent the condition from developing into something serious, and hopefully you can stop any chance of failure in your body and prevent it. Okay, so about 20% of people in hospitals will experience hypokalemia, and only 1% of adults not in the hospital have hypokalemia. A doctor or nurse will usually monitor during your stay to prevent hypokalemia from occurring. This is for underlying conditions, as we said before. You should seek medical attention if you're vomiting for more than 24, like for more than 1 or 2 days. I don't know, like 24 to 48 hours. But yeah, so if you're vomiting for more than a day and it won't stop, you should really check, because the potassium levels that you have will decrease because of the vomiting.
So here's a potassium-rich diet that you can eat, including avocados, bananas, figs, kiwi, oranges, spinach, tomatoes, milk, peas and beans, peanut butter, and bran. These diets are important in healthy body functions.
These are rich in potassium. Eat a lot of these. These are good for you. Yay.
Okay, well, thank you for your attention. That's the end of the presentation.